Hello and welcome to another episode of Rappler Talk. I'm Sophia Cruz, and joining us today is Dr. John Wong, Senior Technical Advisor and co-founder of Epimetrics, a public health research firm. Dr. Wong has been closely following the COVID situation here in the Philippines, and today we're going to be talking about the recently launched booster rollout in the country. Thank you for joining us today, Doc. Let's
Thank
just
you,
dive
Sophia.
right
Thank you
in.
for inviting me.
Yes, thank you for your time, Doc. So the Philippines recently approved the use of boosters, starting with health workers and senior citizens. Though just as recently as yesterday, we know that the Food and Drug Administration has also given the regulatory approval to expand that later on to the rest of the general population. I want to start off by asking you, why did we decide to allow boosters now when just some weeks ago we know that experts and officials were still saying it wasn't time yet? What big changes have we seen from then and now, and why boost now?
But the DOH stand is always to follow the evidence. No? So they were waiting for evidence that there has been waning immunity with the current vaccines, no? And waning immunity against severe disease. No? So um, the discussion about boosters actually started in the States no, sometime September. And then first week of October, the WHO releases statements saying a couple of things. Now, first, the decision on boosters would require evidence of waning effectiveness against severe disease, no? Either in the general population or in high risk populations, or waning immunity against Delta. No? But they also said that the focus should still be on increasing vaccine coverage with the primary series no, to protect against severe disease. No? Because boosters or starting boosters too early no, can exacerbate inequalities no, by draining supplies away no, from the primary series. No? So subsequent to that, no, the WHO was the DOH was waiting for the WHO to issue a final recommendation sometime mid-November. No? Uh, so far, I haven't seen that statement yet on the WHO website. No, but around that time, no, the U.S. FDA and CDC already made its recommendations. No, so there was already that was the evidence that the DOH acted on. No?
Mm.
Both of them said no. The U.S. FDA and CDC said that uh, there is evidence for waning immunity against severe disease for specific populations, no? Specifically the elderly, immunocompromised, and persons with disabilities.
So what was the really big deciding factor for the country, for the officials and the experts here? Is that what you mentioned, the waning immunity against severe disease? Because
Yes.
yeah, I see. I'm curious though, Doc, because you've been following many of the important COVID indicators in the country. You are also somebody who helps, make projections on what the health crisis here might look like with specific protocols in place and everything. And I'm curious what you see is the impact of a or the possible impact of a booster drive um on how the virus is spreading here, and to what extent it could, protect our health system as well.
Well, we follow several things no, to observe the behavior of the pandemic. No? So we look at indicators for community transmission, hospital system capacity, and public health system capacity. No? So the goal is to reduce or control transmission no? And ensure that we have sufficient hospital and public health system capacity no? All the time. Uh, so what's happening now with the boost with the with the vaccine now is that in the states where well also in Israel no, in the UK where the vaccines had been given much earlier no they've already seen waning immunity no especially among the elderly no so uh, by providing boosters or giving boosters no we're able to prevent hospitalizations and deaths no and thus preserve the the health system, no, and also save lives, no. Uh, so that would be the impact of of the boosters, no, preserving the health system and saving lives, no. It has a secondary effect, which is to prevent infections and decrease transmission, no. But in countries where you don't have enough supply, no, that should be a secondary goal.
Yeah, I'm curious though, Doc, no, because you mentioned, there's that issue about yeah, the unvaccinated population as well, and us having to pay attention to them. You wrote an analysis a few weeks back, um comparing efficiency of rolling out doses with reaching the unvaccinated, particularly senior citizens, because they really have a heavy burden on our health system if they get sick and have severe disease. So, if I'm not mistaken, no, Doc, you mentioned that especially among the elderly, rolling out primary doses, so our first and second doses, could be 5 times more efficient than offering boosters to those who are already vaccinated. Do you um is do you feel that these are sort of competing interests right now? And what's your stand on, yeah, how necessary this may be when you already have this, sort of analysis?
Mm. So, both goals are important, no, kasi both goals will end up saving lives, no. Pero when you have scarcity, no, scarcity in supply, no, scarcity in knowledge, no, what we know about the boosters, no, and other resources, no, scarcity in other resources, no, we have to prioritize, no. So, for example, in terms of supply, no, so we've recently received a huge amount of vaccine doses, no, last October, November, no. So we now have supply for about maybe 68% of the population, no. But the problem has been distribution. For example, the top three regions in the country have received 2 times, no, the doses per capita of the bottom three regions, no, and 70% of regions, no, have below average, below have vaccination rates that are below the national average, no. So um, we need to push the supplies not just down to the regional level, no, but up to the cities and municipalities and the vaccination sites, no. Second, there's also a scarcity in knowledge, no. We know a lot about why boosters are needed and how they work, no? But we don't know a lot about why the unvaccinated elderly and people with lower education attainment, no, are more hesitant, no, um, about receiving vaccines, no. So that's the reason why our vaccination rates, no, part of the reason why our vaccination rates are low now, no. But there's also a scarcity in terms of the attention and time of health workers and policymakers, no. So if you have to administer the primary series but also the booster, no, there's only so much time you can allot to each of these goals, no. So um, in terms of priority, no, I would say that our priority should be to first accelerate vaccination, no, of the elderly priority group, no, A2, no. Second, no, administer the primary series to the two-thirds of the population that still have not received it, no. And then finally, no, administer boosters to the vaccinated, no. Um,
Mm-mm.
the reason being that uh, giving boosters, no, although they prevent hospitalizations and save lives, no, just increase the pre-existing immunity, no, by a little, whereas those who are unvaccinated, no, have completely no immunity, no. Um,
Mm-mm.
but all of these goals, no, can be done simultaneously naman, no? I'm not saying na
Mhm.
do do the primary series first and then delay the booster for later, no. They can
Mhm.
be done simultaneously, but we have to make sure that we allocate the right amount of resources, no, for goals with higher priority.
Right. I'll touch and we'll touch a little bit on that later on. But first, I wanted to ask you about something you mentioned already. One of the evidence that we've been seeing for boosters is what you mentioned, waning immunity against severe disease. Because right now in the Philippines, there are only some populations who have been authorized to get doses by the DOH, so have been allowed to go to centers and get that additional shot. But with the evidence already being presented, and the FDA having recently allowed um, given the regulatory approval for a wider population to receive that. I mean, what can you say about what does the data tell us right now about waning immunity among populations who are not yet eligible in the Philippines to get boosted? Should I be worried, for example, if I'm not part of that population, and should I be um, is there a sense of urgency I should be having to get that additional shot, or what does my protection look like now?
So, um, for people who don't belong to the elderly population, who don't have comorbidities, no, or who are not immunosuppressed, no, the evidence shows that they're still very much protected, no, against hospitalization, severe disease, and death. No, so for those outcomes, no, there's nothing to worry about. No, although there is some um, waning immunity against infection, no, even in the non-priority groups. No? So uh, in the US, no, they have a surplus of vaccine doses. No? So the CDC did recommend that the entire population, or the non-priority population, may get the vaccine. No, they worded it that way. No, that they didn't say should get a vaccine, but they said that they may get a vaccine. No, especially that their winter holidays are approaching. No, then they expect more people to be indoors. No, um, so uh, if you belong to the priority population, no, definitely no, go get a booster. No, but if you're not, no, you can be assured that you're unlikely to suffer the bad outcomes.
Mm-hmm. And I guess as another piece of reassurance, there's still other things to do, like wearing a proper mask, practicing proper hand hygiene and everything, ventilation, all the things that all the experts have been mentioning at this point. But Doc, you mentioned also a while ago, these priorities don't have to compete with one another; they can be done simultaneously. We just have to allocate the right amount of resources, as what you mentioned. But I want to ask you, because right now, right, health workers in senior citizens and immunocompromised people are allowed to get an additional shot. So whether that be a booster or a third dose, but down the line, when we expect, because we expect more people to become eligible later on, I wonder, does the Philippines still have enough resources, enough amount of vaccines to cover a wider booster rollout? Because um you know it just so happens to take place, this whole booster rollout is taking place in the country when you mentioned a lot of people haven't even gotten their first dose yet, or aren't even fully vaccinated at the very least. um
Mhm.
how do we then, yeah, balance those so that they don't start working against each other? Do we have enough resources, and how do we balance that?
So first of all, because of the presence of the Delta variant, no, and the fact that vaccines are not 100% effective, no, the 70% target of herd immunity that we've been talking about since the start of the pandemic no longer holds. No, kasi that that threshold, no, yung 70% was based, or yeah, was based on the assumption of having the same transmissibility rate as the original strain, no, which is having an R, no, in basic reproduction number of three, and it also assumes actually 100% vaccine efficacy, no? But we don't have those vaccines, no. So right now, Delta has a R of 6, and the country has a average vaccine efficacy of about 79%, no. So taking those two into consideration, no, uh, we actually have to vaccinate the entire population, no? Well, except maybe for infants, no, less than 6 months old, no. but we practically have to vaccinate the entire population to protect everyone, no, from disease and death. No, so having said that, no, eventually we will need vaccine supplies for uh, uh, about 100 million people. No, so right now we have about 67, 68%. No, um, so we have two populations: no, people who are unvaccinated, no, for various reasons, and people who have been vaccinated who will need boosters. No, so as I said, no,
Mm-hmm.
we save more lives now vaccinating the unvaccinated. However, it will take longer, no, to vaccinate these people, no,
Yeah.
because there are multiple barriers to them. No? So, for example, some of them are hesitant, no, so it will take a while to convince them, no. In the meantime, we have vaccines also that are near expiry, no. So one way to approach this is uh, for for people who need boosters, no. Remember, these are people who had already received the first two doses, so there's no hesitancy, no. If you call
Mm-hmm.
them, no, they will come, no. So give the vaccines that were delivered first, no, the first in vaccines, no,
Mm-hmm.
um, so that you don't also waste vaccines, no. For the people who are hesitant, no, still unvaccinated, no, where it will take more time to convince them, no, you can reserve the last in vaccines, no, those that are delivered later, no, for them, no, kasi you have more time, no, to convince them.
Mm-hmm. Yeah, sounds like a very complicated task, but it requires um, a lot of attention and management. I want to just step back a little bit, Doc, and talk about what boosters can and can't do for us at this point. I'm curious because you mentioned a while ago it might have a secondary effect of if I'm not mistaken, you said a secondary effect of maybe cutting down transmission. Is that correct? Or what sort of effect might the booster, an additional shot, have on COVID, the virus itself? Um, can we see infections? Can it control infections in the country? Yeah.
Yeah, that's what they've seen in studies, especially in Israel, no, which started boosters in July. No, they've seen that giving a booster, no, reduces both infection, hospitalizations, and deaths. No, so they're very effective against all three outcomes.
Okay, that's interesting. But just as a follow up to that as well, because in the Philippines, of course, we've allowed. If in the beginning we very much encourage people to get the vaccine that's available to you because it's very important that you get protected, we're giving the people option now to pick the additional shot that they want. Does it matter what vaccine brand you get for your booster or your third dose?
Um, well, it's we should still follow the same principle. No, get the best. The best vaccine is still the one that you can get. No? And the DOH has recommended, no, the vaccines that you should get, no, after your primary series. No?
Mm-mm. Um, and okay, right, sir. There's also when we're talking about boosters, we're also there's also a question about the kind of benefit it might have on both the population and on an individual level. At this point in the pandemic, though, do you see that it's going to have a big impact on a population level, or are its benefits mostly like for an elderly person or for a health worker or on an individual level, basically?
Um, it will have effects on both. No, so at the population level, no. Although I said that herd immunity may no longer be possible, no, boosters will help preserve the health system. No, if you preserve the health system, no, you allow it to function to also treat people with other diseases. No, remember, although if we're in the middle of a pandemic, no, people still get sick, no, from other causes, no. So that also helps the entire population. At the individual level, no, people who have comorbidities, no, or immunocompromised, no, have their risk, no, reduced, no, by having boosters. No? So it works at both levels.
Okay. Interesting. But so yes, Doc, just let's moving on a little bit. I also have to ask you, of course, about latest developments. The WHO just designated Omicron as the newest variant of concern. Do you think this development adds urgency to the need for boosters for a wider population, or is it too, or do we not have information for that yet?
But it's too early to tell. No, the reason Omicron was is has caused a lot of concern. No, is because of the multiple mutations that they saw. No, but mutations don't always turn out to be or seeing specific mutations are not always predictive, of how the virus will actually behave, in real life. So we probably have to wait a few more weeks now to see whether it's more dangerous in terms of transmissibility, severity, or immune escape. But we should continue practicing what we've done before, no? Because the Omicron is a variant. No? It's not a completely new virus, no. So everything we've been doing before, no, should also work, no. Um, Masking, no, improving ventilation, and getting vaccinated, no, if you're not vaccinated yet.
Right. So in terms of urgencies, if I'm somebody who has already been vaccinated, would you say that I should be okay for now? And it's really just getting more people to get vaccinated at this point, which would really help um, the the health system in the country.
Yeah, kasi
Mm-mm.
Omicron is still being studied, so we don't have evidence yet, no, na we will need to, for example, reformulate vaccines, no.
Mm.
But we already have strong evidence that the current vaccines now work even against Delta, no. So that's what we should be doing now, no, getting more
Yeah.
people vaccinated.
Mm-mm. I'm curious though, Doc. Just some of my last few questions. What role do you think boosters will have in the pandemic going forward? And in the trajectory really of this whole entire health crisis.
Um, so we're talking about the future of the pandemic, no, and how it will end, no. Um, for me, I think pandemics end when people start to feel safe again, no, and they feel safe, no, when their fear of hospitalization and death have decreased, no. So boosters have that role to play, no. They reduce hospitalization and death among a subgroup, no, a priority group, no. But we should always remember, no, that they are uh, just one among several strategies, no, that we should be implementing. No? So boosters will help, no, and the pandemic, no, but uh, it cannot be the only strategy. No?
Mhm. Do you think those are that is it possible, Doc, that boosters will be needed annually, every 6 months? Because if we're talking about you know quote unquote living with this virus, is that something that you see down the line? People are going to be having to get every year or for whatever time period.
Um, it's still too early to tell, no. But one thing we know that is that so one of the reasons we needed boosters is um, winning immunity from variants, no, specifically the Delta variant, no, and mutations and the variants come from mutations. The more transmission we have, no, the more mutations we will have, no, and the more variants, no. So uh, one one of the most important things we need to do is to vaccinate as many people as we can, so that we can reduce transmission. And when we reduce transmission, mutation, and variants, no, there'll be less need, no, for boosters in the future. No? Uh, I I read in the newspaper. No, one of the African scientists said that well, his reaction to the Omicron was addressed to the Western countries, and he said, "We told you so," meaning uh, when the vaccines were developed, no, um, the African countries were asking for vaccines, and they were not given enough vaccines, no, initially. No, so that could be one reason why a new variant now has emerged, no, or was
Mhm.
first detected now in Africa because of the low vaccination, no, in the continent.
Right. No, Doc. I just as a very last question, Doc, because right, there are a lot of um, as somebody who, for example, as a person who is going through this whole health crisis. I mean, you have boosters on the way. You have this threat of this new variant, and then you also have the fact that just COVID is still around. Um, if you're already vaccinated, just as how should you behave at this point if you're not allowed to get a booster yet?
Um, okay. So first of all, if you're not in the priority group, no, you should be assured that your risk for severe disease is low. No. Uh, Second, even without the new variants, no, but even before Delta, no, we realized that the vaccines, although good against severe disease, are not that good in preventing infection. No, um, so you look at vaccines, no, your primary series of vaccines, as one among several measures, no, you should take, no, to prevent an infection. No? So although infections are mild, no, in most of the population, no, uh, there's still the risk of long COVID, no, which nobody wants to suffer, no, suffer
Mhm.
from. No? So still continue masking, no, when you're indoors, no, with other people. Make sure you have very good ventilation, no? And of course, no, do the other things that will ensure that you have strong immunity, no, like getting enough sleep, no, getting a balanced diet, no, and exercising.
Right. Well, it's good to hear that there are many things that we can still do. And of course, we'll be closely following these developments, especially as more scientists figure out what exactly the threat level of Omicron is. Dr. Wong, thank you so much for being with us today. We hope to have you again next time, and we'll be closely following your work as well. I'm
Sophia,
Sophia Thomas Cruz. Yes,
can I just show one slide?
of course, Doc.
Uh, just to show how we can get the uh, unvaccinated
Mhm.
vaccinated. No? So this is a sort of a snapshot now of um, where we are now, no, in terms of our vaccine program. No? So
Okay.
our target should be almost 100%. No, I excluded the infants less than 6 months old. No? So our target is about 96%.
Mhm.
We have available supply for uh, si- um, 67% of the population. No? Uh, we still need a little more, no, to reach
Mhm.
96%. But the main problem here is distribution, no? Getting it down not just to the regions, no, but also to the cities and municipalities. And there
Mhm.
may be some transport and storage issues there. No? Second, no, in terms of accessibility, no, the
Mhm.
SWS survey says that about a third of people say that they have no access at all to vaccination sites. No? So we have to make sure that we bring uh, the vaccines to the communities, no, for this segment, no, rather than wait for them to come to the site. No, um, also seniors,
Mhm.
no, excuse me, seniors, which currently is only at about 60% vaccinated now, may have mobility issues now in going to vaccination sites.
Mm.
Third, in terms of acceptability, so this is vaccine confidence. We've actually had a lot of progress now over the
Yeah.
past 4 months. Now, our vaccine confidence had doubled now, from 30 to 64%. No? But there's still some uh, um, high risk groups. No? For example, people with fewer years of schooling have higher vaccine hesitancy. No? So we still don't understand the reasons for this. And we need to do the research as soon as possible. No? And finally, you see that gap between acceptability and contact. No? So
Mm-mm.
64% want the vaccine, but only 45% have actually come to get the vaccine. No? So there are other issues involved there. No? Um, People who can get off work kasi they cannot lose a day's income to get
Mm.
vaccinated. And then the day after, they're suffering from the side effects of vaccination. They have to take an additional day's leave. No? So
Yes.
uh, if employers can give vaccination leaves, paid vaccination leaves, that would help greatly in getting people to make first contact with the health center. Also, what would help would be longer vaccination hours after 5 or on weekends.
Mm-hmm.
And then finally, encouraging people to come back for their second dose after they've had their first dose. So
I
these are
see.
all the issues that we have now, and if we're able to address them, we can increase the vaccination rate in the population.
Mhm. Doc, just a very quick question about the slide that you're flashing on screen right now. When we talk about availability, we are talking about just for the first and second doses, or does this already include boosters for those who are? This is already take into account the amount of boosters that we will need for the currently eligible populations at least.
Uh, well, since we already started giving out boosters, um, the boosters are coming from the same supply. No?
Mm-hmm.
So we only have 67% of what we need. No? But this is split between primary series and boosters.
Okay. Sorry, doc, just to clarify that. So, well, in other words, kulang pa rin. If we're going to be opening it to other groups later on, the booster rollout, I mean. But right now, for the eligible populations who can get an additional dose and those who need to get a first and second, we are covering about 60%, 67% of our need.
Yeah. Eventually,
Mm-hmm.
we will need to buy additional doses now for boosters.
Mm-hmm. Just as a very last question, Doc, do you see, because of course down the road we also see 5 to 11 year olds becoming eligible because that's currently the age bracket that's allowed right now in other countries like the United States. But then um, we're saying that it could go as early as children who are at least 6 months old.
Yes, yes. Some vaccine manufacturers have already started trials for 6 months to 4 years old.
Mhm. Okay. Wow. Okay. So a lot of things down in the pipeline, and definitely many things that we will be keeping track of. So we will definitely be having you back on our show again, Dr. Wong. Thank you so much for joining us today. Thank you for sharing your time. This is Rappler
Yeah.
Talk. I'm Sophia Toma Cruz. Please join us again next time.
Thank you, Sophia.
Thank you, Doc.